for our community. So today we're talking to Dr. Anuj R. Shah. Hi, Dr. Shah.
Hi, how are you doing? Thank you
I'm
so much
great. I'm
for having
great.
me here. Super excited.
No problem. Thank you for joining us today. So I was giving you a brief introduction. We, again, we in the African American community, we deal with high numbers of obesity, which I am one of those numbers, high numbers of diabetes, high numbers of cardiovascular disease. And that is your specialty. So we want to get to know you. We want you to introduce yourself to our audience and tell us about yourself and why we're talking today.
Yeah, so my name is Dr. Anuj Shah. I am a heart and a vascular specialist, and health in the African American community is very vital to me. I'm very passionate because I've spent my life in amputation prevention, and as you may be aware, amputation happened to be a huge issue in this community. African American, your likelihood of getting amputation is 400% more than the non-African American counterpart, and it's not a surprising number. So that's why when I saw the numbers with COVID, uh, it broke my heart, and no pun intended. But I wasn't surprised, to be very honest. One of my offices actually is even though I'm in Bergen County and work at Hackensack Hospital. One of my offices is in Irvington area, which is also predominantly African American population. We see a lot of heart disease, circulation problems, and all that. So, yeah, I'm not surprised. I mean, in the United States, around 13% of the population got COVID. But if you look at the African American population, almost 30% of them. So if you are African American, you are 3 times more likely to die from COVID than the non-African American counterpart. Not surprising, as I said, because all the risk factor happen to be so much more common in the same community.
So, and on this call, a lot of us have lost people like that we actually know. I've lost people in our family. I just got my results back from my last COVID test. I am negative, thank the Lord. But it's scary because it's like, okay, you have these risk factors. We know, like I was saying, my lifestyle is very sedentary because I'm a computer person. I sit on the computer all day.
Of course.
But also, I talk about, eating bad and whatever, but, I don't live in a food desert. I don't live in a place where there's no access to gyms. And I have, thank God I have, the means to be able to subscribe to those things, to work out. But for people in areas, you say Irvington, you talk about Passaic, you talk about Patterson. What are some of the things that need to take place, I guess, structurally and socially, so that people can have better health outcomes overall?
Yeah, so you're absolutely hitting the main issue at heart, which is it's important to change things as an individual level, but I think it's more important to change it as a community and society level, and even more important at a structural and organization and government level, to be very honest, right? I mean, we know that if unfortunately, Black folks, if they have symptoms, they are not taken seriously. So even my community, my colleagues, medical community and doctors are also at fault, because there are multiple studies proven again and again that in healthcare, we always say genetic code matters, right? Because that's what matters more than the genetic code is your zip, where you live, and the color of your skin. One of the I always say that every heart is the same color, right? Whether your skin is different or not. But in reality, if your skin color is different, your heart gets different treatment. So we know that if you're African American and you go and complain of pain, you are less likely to be taken more seriously. So we have seen this all across the board. I see it in the world of cardiology all the time, especially if you're a woman. Actually, if you're a Black woman and you go to the emergency room, you have chest pain, chances are you'll be discharged saying it's like, oh, this is gastritis or this is some kind of discomfort. I see it all the time in lower extremities, and this is one of the predominant reasons. If you are African American, chances are you're not gonna get basic screening in the doctor's office. Even if you go and tell your doctors, they say, they get less pain meds, they get less testing and less screening, and it's a huge problem. Even if we see that in cesarean section, right? I mean, your color of your skin matters because the cesarean section rate is much different
Mm-hmm.
in African
Mm-hmm.
American community, and maternal mortality is
Mm-hmm.
very. So this is all across the board from obstetric issues in childbirth all the way to amputation and peripheral vascular disease. And we
Mm-hmm.
know that if you get amputation, your risk is as high as stage 4 cancer because
Yeah.
people who get amputation, their individual mortality is tremendously high. So I'm not surprised.
Mm-hmm.
Unfortunately, I'm not surprised with the COVID numbers because if you're diabetic, you have end-stage renal disease, you are on dialysis, which again, I'm sure every African American person knows somebody in their family who's on dialysis. So
Yes.
these things play a role. I think as a society, as an organization level, things need to be made changes.
Mm-hmm.
We need awareness in the community of people themselves and their family members. Like young folks can be more aware and take more interest in their elderly, and
Mm-hmm.
really make sure that they're getting true attention. They're getting
Mm-hmm.
all screening for the blood pressure, cholesterol, electrocardiograms for the heart, and stress test if they need it. Same way they got attention for the vascular screening, which is very simple and effective. And the
Mm-hmm.
medical community needs to be educated as well. That hey, like if you are a certain ethnicity, you need much more
Mm-hmm.
careful attention.
So to that point, my husband is also a physician, and he had to take this course. They put everybody through a course about implicit bias and training for that. So one of the things that we've been talking about are, like you just said, how the strong Black woman trope is what's causing this internal bias to say, okay, well, they don't need as much as far as pain meds, or maybe she's just anxious, she's not having a heart attack, or all of these things. How do, in your words as a physician, how does your community talk to each other and try to change these perceptions? Because if I feel pain and someone with blonde hair, blue eyes feels pain, it should be the same. It should be treated the same, and it's not. So how do you guys talk to each other to change that, internally?
Yeah, no, absolutely. So I think, the training for implicit bias is definitely a great step forward in this direction. I don't think people mean ill. I think it's, people do mean well, at least in the medical community. I know that, but it's
Mm-hmm.
just like not having the radar. So if someone with blonde hair, blue eyes is having pain, and someone with a darker skin is having pain, not only they should be taken seriously, sometimes the latter has to be taken even more seriously because they are inherent with multiple risk factors, right? Because there is, as you said, from being overweight all the way to higher risk of smoking, hypertension, inherent kidney problems. Especially when you
Stress.
talk about my population, which is like above 60, 65, you're
Mm-hmm.
talking, a lot of lifestyle issues, lack of
Mm-hmm.
exercise. All these things have to be taken into account.
Mm-hmm.
And motivation has to be different, medical therapy has to be a little bit different. I think
Mm-hmm.
it only can come with raising awareness and dialogues like this, because
Mm-hmm.
this should be brought to the forefront of everyone's attention. That listen,
Yeah.
just because you're having pain in your legs doesn't mean it's old age and arthritis. It could be a serious
Yeah.
circulation problem. If you are having a little bit tightness or shortness of breath, it's not old age or blood pressure. It could be a serious cardiac problem. So
Yeah.
educating every member in the society and all the healthcare members.
Mm-hmm. Okay, so let's play a game. I am, like I said, I am overweight. I am 41 years old. I'm not going to tell you my weight, but I present to you at this stage of my life. What would you tell me to do as far as, just basic prevention at this point of the game?
Yeah.
Not diagnosed with diabetes, not anything like that, not pre-diabetic, but how can we prevent some of these things? What would you tell me that I need to do?
So if I were to say that you were to get lung cancer if you don't stop smoking, would you stop smoking? And I know you're not a smoker. Would you even
Mm-mm.
consider smoking?
I would consider it, yes.
Right? So the thing is, people make changes when there is consequence.
Yeah.
Right? So if somebody spends time with them, if I sit down with you and I explain to you the consequence of not
Mm-hmm.
working on the risk factor. So I always tell people lack of exercise is as
Mm-hmm.
big of a risk factor as smoking. And a lot of people in today's day and age are already aware of this. They feel,
Mm-hmm.
you know what? I mean, smoking is bad. It can cause cancer. And
Mm-hmm.
sometimes people still can't quit smoking, but when they get cancer, they definitely quit smoking, right? Because
Yeah.
So sometimes, these pain points are so essential in life that you need to feel that pain. And I kind of go through that journey. I say, listen,
Yeah.
right now you're in my office, you're 41, it's 2020, you are feeling great, you're fantastic, you're not even pre-diabetic, which I would check, by the way, on labs, because you'll be
I just
surprised
did.
how people feel like they're completely healthy and they happen to have issues. So I
Yeah.
would do a thorough analysis with, EKGs, simple circulation testing, depending on the symptoms and your family history and risk factors.
Yeah.
Having said that, all that is negative, even then, I think what we can do is we can look at the magic 8 ball. Okay, we have this crystal ball, which is what we call a risk calculator. We have a
Yeah.
framing and risk score, and we can sit down and we say, okay, 2020, you are great. What is your risk of getting a problem in 2030 when you are 51? What is
Yeah.
your risk in 2040 when you're 60 years old?
Yeah.
And sometimes the curve goes like this.
Yeah.
Just a little minor changes, even 10-point increase in blood pressure than normal puts people at risk higher risk of stroke by 10%. So every millimeter in blood pressure counts, every ounce of salt you take counts, every day you don't exercise that counts. So everyone knows what are the healthy habits, but I pay a lot of attention on how to form healthy habits.
Yeah. Yeah. So yeah, that's important. Okay, so tell me about your work at Apex Heart and Vascular, because I watched your videos. You're very adamant about care during the COVID crisis. You work at several locations here in the area. So tell us about your work and how it's been changing in the past few months.
Yeah, and also, as I said, my work involves working in the front line at COVID. I work as a cardiologist and a vascular specialist, and as you know, COVID caused tremendous cardiovascular consequence. As a matter of fact, a new study came in the European Heart Journal 2 days ago, talking about now that we are scanning all the people who had COVID, 60 to 70% have lingering impact of COVID and irreversible consequence of COVID. So, of course, that plays a huge role. Vascular wise, so we saw a lot of people who during COVID had blood clots in their leg arteries, blood clot in their leg veins, heart attacks from COVID. So obviously I took care of all that. And then on the other side, in the community side, we have a lot of folks in our office setting who ended up having either COVID or COVID-like symptoms, or they got palpitation. So we have been trying to educate people, social distancing, making sure people understand when to get the test, what to do if you can get tests, because for months we could not even get simple testing in the community. So my work has been on both fronts, and now that it looks like the first wave is over in New Jersey, we are seeing and we are waiting for this potential second wave. It may or may not happen, but what I am seeing is a tsunami of COVID related consequence, which is people who got COVID and now they have lingering impact on the heart or circulation. There are folks who never were diagnosed with COVID because they never even got a test. Now they come to the office and we see they're having palpitation, they're having leg discomfort, and we are identifying arrhythmias, leg clots, and it sounds like they either had a COVID. And then there is a third group where people had serious heart and vascular and they completely ignored it because they were so scared to go to the hospital. So we are seeing that. So I feel like COVID has caused multiple ripples. It's not just one wave or a second wave, and we are seeing the aftershocks.
So with the aftershocks and people being scared to go to the hospital, I know, in this area, we get the New York commercials, and there's a commercial out right now telling people you have to get your care about all of your other issues. Don't neglect that because you're scared. So what would you say to that point?
I agree.
People being scared to even step into a hospital.
Absolutely. I think there are two advice. One is COVID related. Again, we think the worst is over, but we never know. So definitely, keep the social distance, wear your mask, be smart. Of course, the phased opening, I think, is the right way to go. And then pay attention to your overall health. If COVID taught us one thing, that I hate to say that, but it's the survival of the fittest.
Yeah.
Right? I mean, COVID taught us a nasty lesson. It's a nasty disease that it really brutally affected the vulnerable population. So guess what? Be fit. Pay attention to your regular routine healthcare. See your doctor. Make sure your blood pressure is in control, diabetes in control. Make sure your blood work is okay. Exercise, stop smoking, all the healthy things, and get screening. Nowadays, diagnosing basic, being a cardiovascular specialist, I would say basic cardiac and vascular conditions are very easy to pick up. So ask your doctor, have a dialogue. Most doctors' offices are, by the way, open. A lot of people were scared to come to the office. everyone's doing telehealth, including us, you know. So
Mm-hmm.
there is no fear of going and seeing a doctor. It's actually
Yeah.
much easier than it ever has been.
To go see, yeah. And probably much safer because everybody's on their P's and Q's. Yeah.
Yeah.
So what are some final thoughts for our audience? What do you want them to know about, you know, our heart health, about our community public health situation as far as Black and brown people? What are some final thoughts from you?
So final thoughts are, you know, we have to accept the reality, right? That we are more vulnerable population, you know, just by the nature of our race, our lifestyle, our upbringing, our communal setting. Having said that, it's not the end of the day. You know, you can still choose to have a healthier lifestyle, get
Mm-hmm.
early detection, get
Mm-hmm.
screening,
Mm-hmm.
and prevention. Those are the things. And then if you, God forbid, if you happen to have symptoms, absolutely don't ignore it and
Yeah.
find provider who's going to believe you and who's going to do the due diligence and you know, take you all the way to the promised land and get fixed. You know?
Yeah. Okay, so where can we find more information about Apex, about you? Tell our people where they should go to get more
Absolutely. So
information.
we are on apexheartandvascular.com. We have several offices in northern New Jersey. We are available and open for routine care, cardiac care. As a matter of fact, I want to offer you know, free cardiac screening and free vascular screening for any viewer of yours who's watching this until, you know, for next 4 weeks. Just
Okay.
with your name, and we would love to take care of anyone with any folks, you know, family members or whoever. You know, we really want to make an impact in this community.
So free cardio screening and vascular. Say
For
that
next.
again. I'm going to take a note.
So if you or your loved one has any concern about your cardiac health, if you happen to have any symptoms, if you don't have no symptoms, you just want to make sure everything's okay, please you know, reach out to us. We can see people in person in our offices, or we can do telehealth, and we'll provide free cardiac screening, and we will provide same thing for circulation because it's such a huge problem in the community, and amputation is a huge problem. You know, we will do free vascular screening as well for the next 4 weeks.
Okay, so you heard it here first, guys. Thank you for that. If you contact Apex, let me get your website up. I'm sorry, so they can go to you directly and let them know that you watched Dr. Shah today here on Bergen In Color Live. ApexHeartandVascular.com. Apex, APEX, heartandvascular.com. Let them know that you met Dr. Anuj Shah today on Bergen In Color, and you can be screened for cardio and vascular screening and just general dialogue about your heart and vascular health. Correct?
That's absolutely correct. Thank you so much.
Thank you so much. This is really helpful, and we'll talk offline and get this circulated a little bit better. But yeah, thank you so much for joining me today. I really appreciate this information, and after this call, I'm going to go run some laps and get myself together because I don't want you to have to see me in other circumstances.
If anyone has any question, they want to just send us a message, you know, please feel free as well.
Okay.